Look younger without going under the knife, but is it a good idea? Dr. Patti Flint is here to give us a little more information. Welcome to Sonoran Living.
Thank you so much.
You know, we hear so much about those non-invasive treatments that tighten the skin, and we're all just praying that they work. What do you think about them?
Well, I think they can work in properly selected patients, but not for everybody. And I think it's very important that expectations are managed, because those non-invasive treatments are not going to magically make skin jump back up if it's drooping, and picking patients properly is really the key.
Well, there's a lot of different things out there, and we hear about a lot of them. And I think we're hoping, you know, we hit a certain age that, oh, please let this one work. Because, you know, you might be on a budget and you're just praying that they work.
Of course.
What kind of different things are out there? I mean, there's lasers and...
Sure, you read about non-invasive laser, you read about thermage, Fraxel, and I think many of these therapies are designed to try to tighten collagen and thicken your skin, and it sounds like a good idea. The problem is, if you look in the mirror and you're lifting up on your cheeks, you're moving the tissue almost a half an inch. Fractional lasers lift the skin maybe a millimeter or 3 millimeters, so a very small fraction of sometimes what's expected.
Right.
So when I meet with patients, I talk to them about what their goals are, because that's really what's most important. And if they're just looking for a minor refresher, some of those therapies might be a good idea. But if they're truly talking about loose skin in their jawline or their neck, that's when surgery has to be introduced.
Right. Well, I mean, I know I've been one to stand in front of the mirror and pull my face. And one of the treatments you were talking about was thermage, where it works how much?
It's a radio frequency device that actually heats the deeper layers of the skin. And it has been shown to stimulate collagen production and repair. It's a good thing. But it doesn't change gravitational changes in the skin.
Like the jowls?
Exactly. If you have extra skin on your jawline or in your neck, it's not going to tighten that to the degree that a normal patient would expect. So I think it's really important that we educate patients on what is possible with these non-invasive treatments. They do come with minimal downtime, but they can be quite expensive, and we want to make sure that the expectations are controlled.
Well, and I think if you're going to spend, you know, $5,000 or $10,000, you're going to want to look more than 1 year younger. You're going to want to look 20 years younger.
Exactly. And when I meet with patients in my practice, I have to help them understand what's possible with these non-invasive treatments and what we might want to consider if they want a more complete rejuvenation.
So who works well with these treatments? I mean, obviously someone that's 60, you know, and that gravitational pull has really done a number. Obviously, just, you know, some facials, that's not going to do it.
Exactly right. And when I evaluate patients for facial rejuvenation, I take a three-prong approach. First of all, I look at the quality of their skin. Skin care is a super important part of trying to look youthful and rejuvenated. If the skin looks unhealthy, no matter what type of laser or surgery we do, you're not going to get the best results. So I think it has to start with doctor-prescribed skin care. I then look at furrows in the face, because I never want to use tension to make someone look better. Tight surgery is not good surgery. Think about it. When you were 25,
you mean like this?
Yeah, did you look tight? You didn't. You looked youthful but not tight. So I never want to use tension. So some of the deeper folds that can occur in the face are better treated with filler than tightness. And then if we truly have lax skin in the jawline or the neck, that's when surgery needs to be entertained.
Well, I know you're talking about, you know, the skin care, but sometimes I think that you guys are just saying that. No offense to you.
No, I completely
Dr.
understand.
Flint, but aren't you just trying to sell me something?
No, in fact, I'm trying to give you more youthful skin with products that I have read the research on, and I know that they have an efficacy.
There's really a difference between what I buy at Walgreens, not that I do, just so you know, but there is a big difference?
There absolutely is. In fact, in this country, anything sold over the counter is not allowed to have enough active ingredient to really do much for your skin. You're much better off investing in a consultation with a board-certified plastic surgeon who is knowledgeable about skin care and can tell you how these products can really make a long-term difference.
Well, and I guess if someone's paying money and they're going to come see you and get your professional advice, I mean, that's what they're coming to you for, is for professional advice.
Absolutely.
You're not just telling them what they want to hear, you're telling them the truth.
No, absolutely. It behooves me to get their skin in better shape, because even if I do the best facial rejuvenation surgery ever done, if the wrapping paper doesn't look good, it takes away from the surgical result, and the patient's not as happy.
Right.
And the skincare we have now actually has been proven even to decrease the development of skin cancer. So it's not only corrective, it's preventative.
Well, thank you very much. Your skin looks beautiful, and we look forward to talking to you more and getting some more great advice.
Thank you.
Dr. Patti Flint has 2 offices in the Valley, one in Scottsdale at 7301 East 2nd Street, Suite 200. The other is in Mesa at 1520 South Dobson Road, Suite 218. You can reach her by phone phone at 877-91-FLINT, which is 877-913-5468, or online at pattyflintmd.com. Patti Flint, MD, is a sponsor of Sonoran Living Life.